Hi, everyone. It is Preeclampsia Awareness Month and Maternal Mental Health Awareness Month. So today I have a very special video for you and a very special guest. And I want to first introduce myself. So if you are not familiar with me, my name is Christy Rich. I am a holistic health practitioner. I've been a holistic health practitioner for over 20 years, and I'm also writing a three-book series on maternal health and childbirth through a holistic perspective. And I'm also a speaker. I am the founder of my business, The Dancing Curtain LLC, and I'm also the founder of the Pre-Motherhood Movement, which is a new movement that I have created, which is connected to my book series to encourage women to learn about childbirth, to prepare, to plan before they conceive for better health and birth outcomes. So today I'm very excited to bring Kedna May on. And let me go ahead and read her bio so you know more about her. Kedna May is the founder of K. May Photography and K. May Inspires, two brands rooted in legacy, empowerment, and purpose. She serves high-achieving women and mothers through luxury portrait experiences and faith-forward thought leadership on pivoting with grace and self-compassion. Photographer, podcaster, author, nurse, practitioner, believer, and encourager of the unseen becoming possible. Okay, beautiful. We are going to have a great conversation today. So, welcome, Kedna.
Hi, I'm so glad to be here. Thank you so much for that beautiful intro.
Oh, you're so welcome. I'm so happy to have you today and to hear your stories. So, again, if you are watching on YouTube or Substack and you've been following me for a while, you know that I have been collecting stories for my three-book series, and I have been collecting the whole story. So, from sometimes before birth, definitely pregnancy through postpartum, to really understand women's journeys. So today we're going to have some story time with Kedna, and I'm super excited. I've heard many stories now. I've heard like over 100 stories, if you can believe it.
Wow,
Yeah,
amazing.
from mothers and from childbirth experts. But Kedna's story, I think, is going to be a little bit different because not only are you a mother, but you're also a nurse practitioner. So
I
I'm
am.
very curious to hear how your experience was. So far, I've only, I think, interviewed two other nurse practitioners who also shared their birth stories. So
Yeah,
I'm very, very excited to hear your perspective since you did have a health issue and how that affected you.
yeah.
So let's jump in. Let's jump right in. So, if you want to give a little background to your story, I don't know where your beginning is. I don't know if you had been always excited to be a mom, if this came up unexpectedly, if you had any fears about being a mother or childbirth. What is your beginning?
Thank you for that. Wow. The beginning definitely starts as probably 12-year-old me. I've kind of always been I don't know, goal oriented and very driven. And from the youngest I could remember, I kind of planned my life out. And motherhood was definitely one of my goals. I said I wanted to be a mom, a wife, and a worshiper. Those were like my three top goals because my faith is also very important to who I am and where I go in my journey in general. So motherhood was always something that I wanted, a title that I wanted. I wanted the title of mother. I've always been a nurturer, and I felt like this was just a part of my life story is to have children. At one point, I remember wanting to have four children. It was I had a theory about, having one child and then having two children, and then you have middle child syndrome. I was like, okay, four is the perfectly round number. And now I laugh when I think about that theory. But I became a mother later in life. I I had this journey to motherhood that was a little more unexpected than I thought, in the sense that the timeline that I probably initially had in mind wasn't how it unfolded for me. I have been when I finally had my son, I had been married already for 8 years. So it wasn't like we got married and it just happened. And I have some theories about why it took that long, but I'm so grounded in divine timing that I no longer kind of question my timeline anymore. I know that when this happened, it was when it was supposed to happen because it happened during a very, very tumultuous time for the world.
Oh,
Hmm
so
I
recently.
yes, absolutely. So, I had my son, or definitely, we became pregnant during the global pandemic. So
Mm,
in 2020. So my motherhood journey and my early motherhood experiences and my postpartum journey was during one of the most anxiety-stricken, anxiety-provoking, uncertain times in history, global history.
yes,
And
absolutely.
navigating that time was challenging. So a lot of the things I was experiencing, I'm not really sure. I know that there was a lot of overlap with external environmental factors and of course, what was happening, postpartum, hormonally and biologically, right?
Yes, absolutely.
Um,
So let's go
yeah,
in order with your story.
yeah,
And also, you said that you were an older mom. So you
yeah.
were, would you say, considered over 35? You were what they call sometimes geriatric pregnancies. I really don't
Yes.
like that word, but that's what they
I
use.
know, I know, I know. And of course, hopefully we can talk more about how we're rewriting that narrative of the geriatric pregnancy. But so technically, in certain arenas of thought, geriatric or advanced maternal age
Yeah.
starts at pregnancy at 34 and delivery at 35.
Oh,
But of course, societally, we know 35 and up, right? But certain providers look at it differently. So I technically conceived my son at 34, had him at 34, but turned 35 about 5, 6 months later.
I see. Okay.
Yeah. Mm-hmm. Yeah.
Okay. So going into it, was it already the pandemic? What was it already? What year was it?
It was already the pandemic. So we found out we were pregnant in as of May 2020. So it was pretty much the beginning of the shutdown, if we can say that. The
Okay.
shutdown, I guess, happened in March of 2020.
Yes, yes, I
Mhm.
remember it well.
Yeah.
Okay, so let's go through your emotions. How were you feeling emotionally knowing that you were pregnant and this world pandemic was going on and it was a very uncertain time?
Yeah, Christy, it was a dichotomy of emotions. There were so many different things. It was like the happiest time of my life, something that we literally prayed for, something that we waited for.
Yeah.
I, at some point in time, I was uncertain about my fertility, because
Oh,
I felt like it took so much time for us to conceive when really there was elements that were almost fighting against that happening. I like you mentioned before, I'm a nurse practitioner by trade, and I've been in very high stress, demanding jobs for the inception of my marriage.
mm,
We got married, I would say we got married September of 2012, and I started my nurse practitioner career September of 2012. Like literally started my first job 5 days after I got married.
wow.
So I've always been in a high stress, high demand career, and I really do believe that stress plays a very tangible role in the conception process. And for me, because stress always affected me viscerally. I knew that that was one of the reasons why it may have been more challenging than not. And ironically, when the world shut down and we were forced to slow down, that is when we were able to conceive.
Oh, so interesting.
Yeah.
Interesting. So you
Yep.
didn't have to go in as much as a nurse. I know, nurses and doctors were very busy at that time, but it was a slower time for you too with what you were doing.
In the sense that socially we weren't as busy. We had to make some changes in the setting of how we saw patients in the office. So yeah, things weren't necessarily hustle and bustly as before because we had to abide by the social distancing and just the amount of people we can have in the building. So yes, in a very tangible way, things slowed down. We were still seeing patients. So I worked in a very large primary care doctor's office, seeing patients in office and managing their care from head to toe. So yeah, we had to make adjustments based on just all the regulations that were about during that time.
Hmm.
Yeah,
Hmm.
so things were slower. And of course, socially, we weren't going out. We stayed in more instead of we I think in life we keep ourselves very busy at times, you
Yes,
know?
we do. Yes, we do.
And as we know, there was beauty in the chaos when it came to the global pandemic because we were forced to slow down, forced to be more intentional about how we connected with one another. And literally, physically, we were quarantined.
Yes.
So, so our miracle kind of came during that time. So it was a lot of joy in the midst of chaos. Yeah.
Got it. Well, I'm so glad your dream was realized, that you were able to conceive. And
Yeah.
so, how did you feel physically during your pregnancy? And did any other emotions come up in time in your pregnancy?
I actually had a great pregnancy. I
Great.
really did. I had a great pregnancy up until the end, right? When
Oh,
things
okay.
started to shift.
Okay. So,
But
no
I
symptoms at all. No symptoms
So
leading
I
up
would
to
say I
preeclampsia?
had sorry, I would say that I had some nausea, I guess the first trimester, some bloating is how I felt at times. And then towards the end maybe some heartburn, but not really anything that was debilitating by God's grace. So I wasn't necessarily bedridden or couldn't function. I functioned very well. But it was like work and back home. Like we weren't really socializing or having to run errands. Everything was like delivered so it
Hmm.
was a little different. So I was able, I guess, to kind of stay low key for some time. And I really felt blessed in that manner. But things started to shift around week 34, 35 into 30, week 36. Because of me being a healthcare professional, I kept an eye on certain things and
Such
I
as?
have such as my feet swelling and
Mm,
my blood pressure.
yes.
And I have a family history of preeclampsia. Like my mother, when she was having me, she was in the intensive care unit. So
Oh,
because of that, with preeclampsia as well as gestational diabetes. So because of that history, I was very self-aware.
your mother had gestational diabetes?
She did, she did.
Okay. Did you
So
develop that too?
I did not.
You
I
did.
did
Okay,
not.
good.
But because of her history, I just was more hyper aware of what I was doing during pregnancy and what I actually was starting to feel. And I
Okay.
wanted to be more proactive about what I was seeing before things got, to a point where God forbid, I would have been in the ICU as well. So,
Smart, smart, very smart.
yeah.
Okay, so let's dive a little deeper into this. So how was it to know that your mother had preeclampsia and gestational diabetes, and you as a nurse really understanding what preeclampsia is and gestational diabetes and looking for certain warning signs? You knew certain signs to look for to see if
Hmm.
it was progressing. And I
Yeah.
think you said you did have some swelling in your feet?
I did. I did. So that's a great question. I think that that awareness, having medical knowledge does help, right? And the good thing about what you're doing is allowing access to these signs, symptoms, and what women are feeling through their stories, but it's also helpful for the average person that may not have a medical background.
Yes.
So, but I was privy, of course, because of my knowledge to kind of put the clues together because culturally, so I'm of Haitian descent and
Oh,
The Caribbean, there's certain aspects of Caribbean culture where things are kept hush hush, right? So I would ask about, like, she always told me, "Oh yeah, with you, I was in the ICU," and I'm like, "Okay, well, what happened?"
yeah.
And as I became a mom and through my pregnancy journey, I started to put the clues together about what my mom was saying, and then medically I put the picture together. Like she had significant high blood pressure. She even probably went a little bit into, I would say, there was some liver involvement. So it was significant. Like it was significant. Um,
Okay. Did she
yeah.
have some organs shutting down? Was she
She didn't. It
okay?
wasn't
Good.
that
Wasn't
bad.
that okay?
It wasn't that bad, but her blood pressure was just really uncontrolled.
Okay. And
So
she
it's
never had
like,
high blood pressure before, correct?
no, no,
Yeah, and
no.
that's something for people who are watching to understand is preeclampsia is different because it happens in pregnancy and all of a sudden you get very high blood pressure and
Mhm.
women do not have a history of having high blood pressure before, so it's very surprising. So that's why I
Yes.
want to spread awareness that it can happen suddenly even if you don't have a family history. Maybe your mother had the history, but again, women may not expect it if they never had high blood pressure ever before.
Yes, it can be a surprise. It can be something that takes you by surprise because especially, unlike hypertension traditionally, some the risk factors are not necessarily the same. Like you would think, oh, someone that is obese or overweight or, there's dietary influence. It's not even like traditional high blood pressure. I had friends that ate kale every day and drank water and ended up developing, preeclampsia. So it's not necessarily the traditional risk factors that translate to preeclampsia. It just can happen
Yeah.
to anyone.
And did you have any risk factors
I guess
besides your mother?
I would say my biggest risk factor that I could think of was maybe my age, I guess. Sort of. And that I mean, I would say I felt like my weight was a risk factor. Um, but other than that, no, not that I knew of, to be honest.
Okay. And
Um,
African American women also do get preeclampsia at higher rates than
yes.
other races
Is
do.
yeah.
Yes. So, did you talk to your doctor about this? Was your doctor concerned or worried knowing that your mother had preeclampsia and she was in the ICU? Did you talk about this with your doctor?
That's a great question. I don't quite remember if we had this conversation, and I'm glad you mentioned my doctor. Because I don't think she was really as on top of it. And I feel like because she knew that I was a healthcare provider, it was a little bit more lax as far as her asking questions and reinforcing me to take my blood pressure and all these kind of things. I just did that on my own.
Mm,
And then I actually brought it to her attention at week 36. I'm like, hey, I'm actually concerned. My feet
Mm.
are swelling a little bit more. They hadn't before, and I've been checking my blood pressure and it's running a little high.
Oh, and
So
what was
then
high
she's
for you? What did you notice?
um like this without getting super technical, but a little bit. So systolic, which is the top number, um, I would see run between anywhere between 150 and 160. And normal systolic blood pressure is usually anywhere from 90 to 120.
Right,
So
right. And
so clearly, yeah,
you saw that at 36 weeks. You saw 150 or 160 over something.
right. Yeah,
Okay. Okay.
yeah.
And also it's important to bring awareness that in the United States, maternal mortality is very high, especially among African American women. We have a problem. It's often in the New York Times. So again, your doctor wasn't worried about you. It didn't seem like she was concerned. She was very lax.
That's how I feel, to be honest with you.
Okay.
She was a very prominent um provider, and everyone went to her. And she was very busy. And that experience wasn't the best for me.
Mm,
Of
sorry to
course,
hear.
we wanted someone that was trusted and known, but the trade-off is the fact that she is trusted, busy, and well known. And sometimes I feel like because of that, she was too busy to notice some of the earlier things. That's how I feel.
Mm-hmm.
Um,
So you wanted
and
better care. You wanted better care and more awareness of the symptoms as they were progressing.
I did like, here's how I went into that, right? The mindset was gratitude, right? Because I understood that I had access to care, and there are women around the world and even locally in the United States that don't necessarily have access to prenatal and perinatal care. So I went into those doctor's appointments, even though I waited, Christy, for 3 hours to be seen for 15 minutes or less. I still went in with gratitude
Three
because
hours each time or at the
three
end?
hours
3 hours each time you had an
on
appointment?
average,
What? That's crazy. That's absolutely
3 hours
absurd.
on
That's
average.
horrible.
Oh, it was horrible.
How'd you have the
But
time? You were a busy nurse.
so I would take the last appointment. So sometimes I would leave because in the office I was there from 7:30 a.m. to 5 p.m. So I would ask to leave 30 minutes early. I would get her 5 p.m. spot and be there anywhere and leave there anywhere from 7 to 8 p.m.
Oh, I've never
Yeah, it
heard of
was
such a thing.
yeah, it was really tough. It was really tough, but like I said, I had to kind of like she's no longer my provider, clearly, because I can't I mean,
Yeah.
but like I said, I was like, God, I'm just thankful to have someone to take care of me. My brother-in-law, who's a physician assistant, he did some internships in South Africa. And he told me, and after this is probably what shifted that perspective for me. He told me that women would wait in line in active labor to be
Whoa.
seen and to have their babies. So
Whoa.
when he told me that, I was like, Kedna, you don't complain. You're in an office, you're waiting, but there's air conditioning, and you have a provider that will see you eventually. But I mean, it was quite an experience. And then, just to give her some grace, it was COVID, so things were just chaotic, right?
Mm.
Um,
But what happened to you? Your blood pressure was so high, your feet were swelling.
so eventually when she realized what I was saying, um, she was in agreement and she sent me to do what they call the 24-hour urine collection.
Mm.
The 24-hour urine collection is basically looking for proteins in the urine that may indicate that the elevated blood pressure could be causing damage to your kidneys, right? To say the least, right? So when I went for the 24-hour urine collection, I went just outpatient to the hospital to their like I guess their perinatal ER or that area, triage area. And I was in a bed. They gave me the canister. I thought I was ready to go home. They did I think they did a scan for of the baby that day too. He was fine, but my blood pressure was still elevated. So they kept me for observation. And that was it. I was kept for observation until I had my baby. I stayed
Oh,
in. Yeah.
they wouldn't let you go and have the 24-hour after they saw your blood
No, they're
pressure
like, okay,
went
you're
up.
gonna do this 24-hour urine collection in the hospital, and
Oh,
we're
you
gonna
did it in the
monitor your
hospital.
blood pressure. Yeah, and we're gonna
Okay.
monitor your blood pressure.
Now,
Um,
sometimes they just have you take a quick urine sample and they can see if there's protein in the urine. So why did she want to do 24 hours instead?
I guess to get a better picture and a more specific picture
More thorough?
and more thorough, yeah.
Okay. And what did it show, the 24-hour urine test?
That I had trace evidence of protein in my urine.
Okay.
So technically, I was considered I had like a mild to moderate hypereclampsia, preeclampsia. I wasn't, I didn't have any kidney damage, thank God, or I
Good.
didn't need any drips. I wasn't in the ICU.
Good.
But at that point they wanted to be more precautious than not. So,
Okay. So what do
yeah.
they recommend to do next?
So I was admitted to the hospital and they were going to do 24-hour observation, like I said, collect the 24-hour urine in the hospital. They did. It showed mild preeclampsia and they decided that they wanted to induce me.
That's what I figured. I was gonna let you say
Mhm.
that. So
Yeah.
you, as a nurse, knew about induction, and how did you feel about that?
Well, you know what? That's funny you mentioned that, nursing is and the medical field is so broad, right? I did not know much about induction.
Oh, you didn't? Okay.
And I did not. I did not. Because my background as a nurse, I'm more on the critical care cardiac side. So
Oh,
the whole women's health and maternal wellness and mother baby, I was clueless to that. It was a course, of course, that we had in nursing school, but of course, at that time, that was almost 15, 16 years ago, right? So if they say, use it or lose it. So I didn't have a background in women's health or maternal baby. So I was a critical care nurse. I knew the heart. I knew, when things are going down, how to interject. But when it came to my own body as a nurse, clueless.
okay.
So I
So
had
this was unknown land. You didn't know what was going to
absolutely
happen.
an induction. Yeah, I mean, I understand the general
Right.
idea.
But you didn't know the process. You didn't know how it's going to
No,
affect your body. And
no,
did your doctor explain that to you before starting it?
no.
No, no,
She
they
wasn't
often don't.
there.
She
She
wasn't
wasn't
there.
there. The
She wasn't
nurses,
there.
of course, the nurses. So at that point, it's like once you're in the hospital, for those that may not know, like the doctor communicates through the nurses, right? Through the nursing staff. She gives orders, and the nurses would come and explain based on what the doctor was recommending. So I was there. They were checking my blood pressure every 15 minutes. And there was different methods to try to induce me, like cytotech, I believe it was. Is it cytotech? I don't remember all the terms, but there's like a pill that they can use to put on or Cervidil, to put on your cervix
Yeah.
to ripen it or make it ready. And then, of course, there's Pitocin, which helps induce contraction. So they were trying everything chemically to try to have this baby come safely and to help with, the blood pressure. So
And at this point, you're how many weeks?
at this point, I am still 36 weeks and almost 37 weeks.
Okay.
Yeah.
Okay.
Yeah.
And then did you develop any more symptoms? How was the labor experience?
So I didn't develop any more symptoms. I just unfortunately failed induction.
Failed?
I nothing moved. Like they would even come in, they're like, "Did you feel that?" And I'm like, "What?" I didn't feel the contractions. I didn't I didn't feel anything. They tried 2 or 3 rounds of the Cervidil. That was probably one of the most painful experiences of my life.
Oh,
The
really?
nurse actually inserting, this little pill that's supposed to help ripen the cervix and get the cervix ready. So I didn't dilate after 2 rounds of Cervidil.
Oh,
I wasn't feeling the contractions with the Pitocin, and I still had high blood pressure. So they're like, we're gonna just have to, you're just gonna have to have a C-section.
oh,
So
okay. Well, I want to say, first of all, you didn't fail, okay? Your baby wasn't ready to be born at that time. No,
I agree with you, but medically, it was a failed induction. That's what I mean. I don't feel like I failed, or I don't feel
okay.
like failure.
Okay,
That's
good,
not it
good.
at all.
Because
But
I know
that,
sometimes medical personnel will toss words out like failure to
yeah, it's
progress.
it's it's medical jargon. But for me, I don't feel like I failed because um when I embarked on this journey and I knew it was getting close to delivery, my mindset was always healthy mama, healthy baby by any means. So I did not have a birth plan. I did not say, oh, I don't want this and I don't want that. I said, healthy mama, healthy baby by any means necessary.
Got it.
So, you know, I was scared when they told me I had to have a C-section because I understood that was a that was surgery,
Yeah,
but if it meant that both he and I would be safe and I wasn't in the ICU or he wasn't in the NICU, please do what
yeah,
you need to do.
absolutely. So let
So
me just
yeah,
ask a question. Did they give you high blood pressure medication to try to get the blood pressure down?
yes, they
Okay.
did.
And it
Mhm.
still didn't work.
Not as effectively or not as quickly maybe as they would have wanted.
Do you know what medication they gave you to try to lower your blood pressure?
Labetalol.
Labetalol. Okay.
Yeah.
And and then you went in to have a C-section.
Yeah.
So then you had your C-section. Was your husband able to go with you? It was
Oh,
oh,
yes.
okay.
So I was in antepartum for 1, 2, 3, maybe 3 or 4 days. And when I was in antepartum, or where you go beforehand if there's any kind of complications, there's a special unit. I was there by myself. So
Mm,
when I switched over to getting induced, so labor and delivery, when I was in the labor and delivery unit, I got transferred over. Then they let him come. So it was only one visitor. It was just he and I.
mhm.
Um, when they were getting ready to induce me for labor and get me ready for delivery. Yeah.
Okay. And how long was your labor?
Mm, I didn't labor. Like I don't.
Well,
I don't.
when did they start like giving you medication to try to
Oh,
open up your
got it.
cervix and
Okay.
get contractions going?
I would say maybe the day after I arrived there, when I initially came to do the 24-hour urine collection, between 24 to 48 hours, I would say, they
Okay.
started the medications and the process to induce. Yeah.
Okay, got it. And then how did you feel after the surgery and seeing your son for the first time?
Um, I felt very happy. Like, I felt very happy. I felt very grateful.
Wonderful.
Um, yeah, I was just very grateful for
Wonderful.
sure. Yeah.
And did they keep you in observation for a while, or was it the normal amount of time after having a C-section?
I actually think we were discharged probably a day before what they normally say is recommended. So they usually they say for C-sections you can stay anywhere from 2 to 3 days after birth, but we stayed 2 days. Yeah,
Okay.
after. We were
And
discharged day 2.
did they give you any pamphlets or information of things to watch in case you continued with your preeclampsia to postpartum preeclampsia?
Yes, I had discharge instructions for sure.
Okay. And did they explain that with you? I know you're a nurse, so again, they may have assumed that you knew it all, but did they go over possible symptoms you may have and to call them right away if you experience them?
Yes, from what I recall.
Okay. And did you have any side effects, symptoms after birth in postpartum?
No. My blood pressure did need to normalize for a couple of weeks, so I was still taking blood pressure medication for a couple of weeks after birth.
Okay. But
Yeah.
otherwise, you were good and didn't have to go back to the hospital.
No, I didn't. I
Good,
didn't. Yeah.
good, good. Wonderful, wonderful.
I
And your
know.
your son was born healthy. He was okay.
Yeah, he was okay. He was okay. He was okay, thank God. Yeah. He was
Good,
okay.
good. I'm so glad. So I
Yeah.
do know another part of your story that you did develop postpartum anxiety. Would you like to talk about that and describe to those who are watching what that is?
Yes, so like I said before, there was a lot of overlapping of emotions and processes at the same time. And I did not get medically diagnosed with postpartum anxiety, but I understood what I was feeling, if that made sense. I had insight to what I was feeling. So after the postpartum period, there's so many hormonal shifts, the lack of sleep, some nutritional deficiencies, they all attribute to our emotional state and our physical state. I've been reading up on this phenomenon called the postpartum depletion syndrome, and
Hmm.
it's basically what happens when we lack micronutrients and macronutrients such as zinc, iron, magnesium. How the body reacts postpartum when those levels are lower, and the association of an increased risk for postpartum mental conditions, such as postpartum depression and postpartum anxiety. So I just want listeners also to realize that there's so many different factors that can attribute to this journey of trying to manage what we're feeling and actually potentially developing these postpartum mental conditions.
Yeah.
So
And
for
I just
me,
want to say one
mhm,
thing real quick to make sure
yeah,
people understand, because I think there's a lot of confusion about postpartum mental illnesses, is that women are often diagnosed with postpartum depression, and sometimes that's like an umbrella, and other,
correct. Yeah, yeah,
diagnoses really are under that. And I
yes,
try to distinguish, I'm writing a lot about postpartum depression in book one of my series because a lot of the
yes,
women who I interviewed did experience postpartum depression, but they
yes,
experienced the postpartum depression, not postpartum anxiety. So I just
right.
want to say that they are two different illnesses.
They are.
And there are other illnesses. There's postpartum rage, postpartum OCD,
Mm-hmm.
postpartum psychosis. They're
Psychosis. Mm-hmm.
all different.
Yes.
And my understanding, but correct me because you experience postpartum anxiety, you don't have the depression. It's mostly anxiety. You want things a certain way, whereas depression, you normally have the crying. You can also have rage. You can have other emotions as well. Is that correct?
Yeah,
Um,
that's
okay.
correct. And just so that listeners really connect with what we're both saying, so clinically, a clinical trained professional is who can help make these official determinations. But you know your body, you know what you're experiencing, and sometimes you don't fully know what you're experiencing, but the emotions are on the extreme side of things, right?
Yes.
Because a lot of women will experience what we call baby blues, where it's
Yes.
just, oh, I'm sad and I'm tired. And there's a lot of, it's attributed to just this new role, right?
Hormones are going crazy. Like,
Sadness,
well, I just did this
overwhelm,
amazing.
hormones, right? You just had a
Yes.
baby and
Yes.
you're trying to navigate that new space. But with the mental disorders, we're talking about very distinct, profound, more on the extremer sides of these emotions and thoughts, right? So it's thoughts affiliated with, with depression. It's just this very, debilitating thoughts, right? And with the anxiety, same thing. It's thoughts that overtake your ability and your capacity to function in the new role. So that's why I don't say that I fully was experiencing that because I still was able to function in my role. I just worried a lot. So
Gotcha.
it was very significant feelings of worry that were coupled with the thought of catastrophe. And remember, we're navigating the pandemic. So my real fears were tied to either me passing away because of COVID or my family passing away because of COVID or us having a death that would affect the postpartum journey in one way or another.
Did you have a death in the family?
We had not my immediate family, but we had a death of a very, very close,
You're frozen for a second.
a
Hold on.
friend's father that was like a father figure to me. And it was
Oh,
pretty,
sorry.
mhm.
Sorry to hear that.
Yeah, it was very difficult. It was very, very difficult. And ever since that death, I was just like sometimes hyper fixated on, and is someone else going to pass away, you know?
And it's a
Um,
very scary time. Like, again, no
yeah,
other time in American history like
yeah,
this. So we didn't have the resources to really be supported because we were all going through trauma at that time.
no,
Now,
exactly.
did you have a history of having any anxiety before you had this experience postpartum?
So I would say that nothing was formally diagnosed, but just being very self-aware and understanding kind of the DNA of high achieving, goal-driven,
Oh, yeah.
very, determined women, there is a level of functional anxiety, right?
Yeah.
That I feel like a lot of us may deal with, and maybe even some underlying ADHD. It takes a certain brain to be a certain person, if that makes sense.
Yes. Yes.
So I could definitely, and I would always say, I'm a worrier. And I say that I got that from my mom. We're both the empaths in our family, the worriers. We'll
Mm.
worry together. And as I kind of went on a journey of understanding, one, when I became a mom, I wanted to be more self-aware so that I could be healthier mentally for my child.
That's
And
beautiful.
and in that self-searching, soul-searching journey, I realized, okay, I think my mom may be dealing with some anxiety. And like I said, culturally, we don't really talk about mental health in the Caribbean much. And then
Right.
I looked at myself, I'm like, there may be something that holds true there. So, during my postpartum journey, I just found myself being overwhelmed a lot and just trying to navigate transitions and wasn't navigating it the best way that I felt, not realizing that it was still just a part of the journey of just getting accustomed to the role, right?
Mm.
But I did seek out therapy at some point when I
Good.
felt like the overwhelm was becoming too overwhelming and not
Good.
manageable.
Did that help?
It did help. It really did help. Because what people may not always understand is that motherhood, though beautiful, can be so isolating. And when I actually embarked on my motherhood journey, it was during a very isolating moment in time, right? And
Yeah.
I think, Christy, to be honest with you, we're gonna have more research and more evidence of the effects of the pandemic on not only first-time mothers, but then the children as well.
I
And then, of
agree.
course, the support ecosystem, like how that was affected. We had restricted social interaction.
Yeah.
So I don't talk about it often because I realize we were blessed to just feel like we survived and we're alive, but it was very tough navigating
Yeah.
first-time motherhood through such a isolating time.
Yes, you said that so beautifully. I just want to say it one more time and recap what you said, that you went through a traumatic time. You went through a traumatic time in your life, but also a traumatic period of history. And this is going to be, a combination of collective uh, intergenerational trauma that's going
Yeah.
to be seen later on. And I
Yeah.
do believe this has happened in other times in our childbirth history, such as when the twilight births were popular, that women
Mhm.
went through trauma of having that experience and then blacking out, forgetting it, and thinking that they didn't remember anything about their birth, and later on remembering, or it just going through the DNA of the children experiencing it. So it's
Mm.
very interesting that you mentioned that. And also, I just want to go back again, what you said. I think there are many different possible root causes of postpartum illnesses, mental health illnesses. And so I want to emphasize that it's not just one
No.
cause for each person. Like you said, you did have somebody very close and dear to you who passed. And when that happens during a very vulnerable time, it's understandable that that would really affect you. And you were a high achiever and you were probably just ready to go back into your old life, but you needed to
Mm.
recuperate and really to
Yeah.
heal and have a slow time, especially
Yeah.
after having a C-section, but also just having a birth. And
Yeah.
probably your mind was like, okay, just let's go back into nurse
Right.
practitioner and go, go, go. But your body's like slow, slow. So it was kind of
Right.
like you were fighting like going forward and going to take care of yourself and heal and take care of your son.
Mm.
So I just
Beautifully
want,
said. Yeah, for
yeah,
sure.
I just want to say that. And also with my book series, I have uncovered another root cause as well. And you also had mentioned about being depleted. Did you feel that you weren't able to get all the nutrients you wanted at that time, that you couldn't cook, so it was hard for you to perhaps eat as well as you wanted to?
I that's great, great, great synopsis and for sure pointing back to that. Yeah. I I don't fully remember the details of like my nutritional journey. I knew I wasn't fully engaged in cooking and trying to it wasn't the easiest for me postpartum. Thankfully I had my mother's help so she would cook at times,
Good.
but the moments that she wasn't here, it was definitely takeout, you
Okay.
know?
Yes.
Um I think I still did take a postnatal vitamin, so I did take a postnatal vitamin, but I wasn't necessarily fully compliant with that. Like I wasn't like consistent with that.
Mhm.
So definitely I think nutritionally, oh, absolutely.
Mhm.
Absolutely. I
Okay.
felt like I was probably not getting everything that I needed. Yeah.
Yeah. And this is something that women don't think about. They plan for the birth, let's plan for the birth, but they don't think about how much preparation it takes for postpartum to have those
Yeah.
meals already made and in the freezers. They
Yeah.
can just heat up or have a food train of other women in the community
Yeah.
delivering food, so you don't have to worry about that because women really do need support during that time.
Yes. Agreed.
Yes.
Yeah.
So let's go into your podcast, shall we? So you are a
Sure.
podcast host, and tell us about your
Yes.
podcast. I can't believe the time is flying by. We're almost out of time, but tell us about your
Uh,
podcast and what it's about and where women can find it.
Okay, thank you so much. Yeah, so yeah, I have a podcast. It is called Musings of a Geriatric Mama. So there's that term back again. And I intentionally use those words to trigger people. And what I wanted to do actually is to trigger us into being open to rewriting the narrative about what it means when a woman embarks on a journey through later in life and not on society's terms. So, the emphasis of this podcast is to create community for ambitious, goal driven women that are journeying through transitions and encouraging them through pivotal moments and um, definitely reinforcing the importance of wellness, mind, body, and soul.
Yeah.
So on the show, we talk to experts in different fields. I've had, family physicians on. I've had entrepreneurs building, generational wealth from the ground up. I have had trauma specialists on, and I just want us to have real conversations about what real women are doing in the real places that they're going. So
Beautiful.
that's just a quick, synopsis of the show and the community that we're building and I just want to empower ambitious women, not only mothers, but mother figures because I just remember a time in my life when I was waiting to become a mother, and I never want to isolate anyone because I feel that all women play a pivotal role somewhere in someone's life, whether that's through
Yeah.
mentorship, an aunt, a godmother. We're all mother figures. So it's for ambitious women, mothers, and mother figures. That's
I
the
love
community
that.
we're building. Yep.
I love that because I'm all about that too. I don't want to isolate and just say only mothers in this community. I feel that there's so much wisdom that we can all share with each other and we can
Yeah.
all build each other up. And it's so
Yeah.
wonderful to have the wisdom from the mothers to the women who haven't become mothers yet to learn and to ask them questions. And
Yeah.
it's just a beautiful synergy. So
Yeah.
I love that you're about that as well. And
Yeah.
where can they find your podcast? Are you on Apple Podcasts? Are you on Spotify?
Yes, I am wherever. I'm on most streaming platforms, including yes, podcasts. Sorry, including Apple Podcasts, Spotify, and YouTube. Yeah.
Fabulous. YouTube too, videos. That's great.
Yes, yes, we have
Wonderful.
video as well.
Great. And I'm excited. We're about to set up me coming onto your show, so I'm looking forward to
Yes,
being a guest.
yes.
And any final words to leave our listeners, watchers with today? Maybe you have some words of wisdom
Yeah,
for women who have experienced preeclampsia or
yeah,
postpartum anxiety, and maybe they're afraid of having another birth and having the
yeah,
same experiences, or
yeah,
maybe even some final words or advice for women who haven't had a child yet, and
yeah.
what you would like to say to them.
Yeah, that's beautiful. Well, first of all, I want to empower you to self-advocate. And the way we can do that more effectively and efficiently is by getting the knowledge, right? Um, Embarking on a motherhood journey is beautiful. And I feel like the more you know, the more you grow. And this is a beautiful investment in your life story, right? So empower yourself with the knowledge to know the things, to understand the signs, to understand the symptoms, to understand, what it may look like. Motherhood is unique. Everyone's journey will be different, but there are threads that loop us together. And so advocate for yourself.
Here, pause for a
If
second.
you feel like something is wrong, if you feel like something is wrong, if you have this gut feeling, let someone know. If you don't feel like yourself or something feels off, let someone know.
Yes.
Because you advocating for yourself can definitely be a stepping stone for a life that is more flourished, a safer journey, a healthier journey. And just know that everything that you have inside of you, the woman that you are now, and that you're evolving to be, is multifaceted. You're not just one dimensional. Motherhood doesn't have to be the pinnacle of your life. It's just a beautiful part of your overall story. And you can do this, and you're beautiful inside out. You're seen, you're heard. There's resources if you don't necessarily if you feel like something's off, there's resources there. There are communities to help you get through this journey well, mind, body, and soul.
Beautiful, beautiful. Thank you, Kedna. It was so great to chat with you. I'm going to put
Yes.
your bio and all your contact information below so people can contact you, follow you, find you. And I hope everyone listens to Kedna's podcast. She's so inspirational. You can tell from listening to her that you're going to want to listen to more and be inspired. I feel so good when I listen to you speak.
Oh,
And yeah, it's a gift that you have. It is a gift. You really bring that love and self-compassion and elevate women. So it's a beautiful gift. So quickly, what is your website for people to follow? I will put everything below, but just
oh
so
yes. Yes, yes. Well, thank you. Well, Christy, I also want to share space with you and thank you for letting me share space.
Oh, you're welcome.
The work that you're doing definitely will have generational impact and probably already has. So I definitely want to um, just give you your flowers and thank you for
Aw,
this that
thank
you're
you.
doing because definitely it's more than just documenting stories. It's really just a catalyst for change for women and children globally. So I just also wanted to say that. But,
Thank you.
but you're so welcome. So yeah, my website is actually kaameinspires.com. I have a blog, I have a newsletter that I am um building. I call it community. It's not spam, but once a month is just a warm hug to remind you that you're wonderful. And when you join the community, there is a wonderful brochure about how to go from burnout to thriving.
Mm,
Because I think that is what a lot of us are feeling, whether mother or building a business or wherever we are in our journey as ambitious women. Burnout just is a nemesis. But
mm,
how can we pivot through transitions purposefully without burnout? So I created a handout that kind of has an assessment there and gives some tools to kind of help us navigate this together.
beautiful.
So yeah, my social medias, KMA Inspires as well. And Musings of a Geriatric Mama Pod is the Instagram where you can find the podcast and yeah, we're just building community, a community that is empowered to evolve and embrace the journey along the way.
Beautiful, beautiful. Thank you again, Kedna. This was an
Yes, thank
absolute
you.
pleasure. And I will include your special link that you talked about, all of your social media, your website, everything below so everyone can see it and click on it. And I also encourage everyone to follow my Substack. It's called
Yes,
Decrease for Joy, and it has a subsection called Healing Childbirth, which is
yes,
in reference to the book I am writing and the
yes.
women who I've interviewed and the research that I've done. So follow me on Substack. I'll put the link below. Follow me on YouTube. It's Dancing Curtain, my business. And follow me on or check out my website, www.thedancingcurtain.com. I hope you
Amazing.
enjoyed this video. I think it was very inspirational, a lot of good information. So please share this to your friends, your family,
Yes,
your newsletter, share it far and wide. If you're watching on YouTube, give us a comment, share a experience, ask a question. We will come
yes.
back and answer that for you. So thanks again, everyone, and have a beautiful day. Bye for
Same
now.
here.